My name is Dylan Mariano, and I'm an architect. I was diagnosed with obstructive sleep apnea.
Long-term consequences of sleep apnea, they're numerous. Heart disease, stroke, diabetes. Since I've been practicing, the treatment for sleep apnea has been, in effect, the same.
I have a face mask that covered my nose and mouth, and it was consistently producing positive air pressure, which I tried to work with for a while, but eventually I reached this breaking point and I called it quits.
It's well known. Most patients who are offered treatment for their sleep apnea don't use it. The vast majority are not able to tolerate the treatment. Estimates are as high as 70, 80% of that group fails.
So a machine's currently in my closet right now.
When you see a problem, my brain just immediately starts thinking about how I could solve that problem. My name is Stefan Marsh, and I am the inventor of the air-ring technology, the smart mask, and I'm the president of the company. If you have sleep apnea and you're prescribed the gold standard treatment, when you're inhaling, you get full therapy, everything is great, but the most uncomfortable part of the CPAP therapy is the exhalation.
Many patients will tell you, I simply can't breathe out with the mask. It's suffocating me.
It can be really difficult to be fighting that air pressure. When that positive pressure is pushing back, you can't naturally breathe out into the room.
That sensation of fighting to breathe is awful.
The air-ring smart mask has a proprietary air switch technology that the air from the CPAP machine flows through to the patient. We also sense the pressure at the patient's nostrils. There's no latency. The response time is immediate. It's going to provide you with the most comfortable and natural breathing that you're ever going to have wearing a CPAP machine. Setting it up is a simple task. You take your mask, put it away, plug our mask onto your CPAP box, and you're done.
I was pretty impressed with the smart mask. As soon as I start to breathe out, the machine stops. I can just breathe freely out into the room and not fight any pressure, and that's huge.
We have ultimate flexibility for maximum comfort.
I just wasn't thinking about my breathing. I could breathe, and the machine was responding directly to my breath, and I wasn't having to put up this fight.
I'm Don Cotter. I'm the Director of Clinical Operations for Regional Home Care, the largest independently owned home care provider in the United States. When I was introduced to this product initially, I was so excited and saw the opportunity. We decided we would purchase $1.5 million worth of this product as soon as it was cleared by the FDA. I believe this mask is going to be a game changer for not just regional home care, but for the entire sleep community. It solves so many problems that have been failed to be addressed by the major manufacturers today.
For air-ring, there's two revenue streams. There's the sales of the first initial system, and then there's the consumables, which are replaced, often.
The revenue that we generate from the initial setup is really insignificant to the downstream revenue that we hope to capture from the patient being successfully treated and compliant with their therapy.
Our productization plan is designed to take the product where it is right now, finalize it, get it into manufacturing, get it through the FDA approval process, and actually in a package and ship to our customer in 18 months. We have 29 patents issued, 4 more allowed, and about 53 more patents that are pending. The barriers of entry for a competitor would be substantial because the approach of the smart mask has not been done before. We are not inventing the therapy. We're not creating that airflow. The standard CPAP machine is doing that. We're just being smart about how we deliver it to the patient. 936 million people worldwide suffer from this condition. This market is huge. We have a product that can help those people. It works, it's ready to go, and it's a multi-billion-dollar market. Air-ring has a couple products, future products in the pipeline. One is the micro CPAP device, the complete game changer. It gets rid of the hoses, the masks, the machine fits in your nose.
The ability to have that small nose piece to provide the therapy that you need to get a good night's sleep and feel well rested is amazing.
So the smart mask for me really, it marks a turning point, I think, in the technology where the breath sensing is really starting to become something that really is working with you and not fighting you. This smart mask really kind of made me think, oh wow, this might actually work. This might actually get the breathing thing right, and I can get some of my life back.
As a CPAP user myself, I know firsthand the struggles of not being able to exhale. My experience with the smart mask was life-changing.
The Airing Smart Mask finally has given us as physicians the treatment options that the patients will be able to use.
You've got to find a way to make technology really do something important, like save someone's life.